And was she seen by a vascular surgeon?
No.
Okay. That would be the first thing that we need to do. I mean, there's a couple things. All of these wounds on top of her toe are because these are rubbing on the shoe.
Это трется об ноги, поэтому об ботинки, поэтому она говорит, что здесь ранки у вас и болит.
So we need to get her into a different kind of shoe that's higher.
Она говорит, вам нужны туфли, обувь, которая сверху, вот здесь.
I would go wide one that is very soft on the top.
It doesn't matter how wide it is, it has to be deep, so that it's not rubbing on her
Не имеет значения,
toes.
насколько они широкие, они должны быть глубокие. Не вот так, скажем, а вот так.
Now, the other thing is that your circulation is not good.
Потом второе, у вас плохая, конечно, циркуляция крови.
And so we probably should get you a referral to see a vascular circulation specialist.
Она говорит, что надо было направление у нее взять или у кого, я не знаю, тот, кто занимается циркуляцией крови.
He didn't suggest.
Okay, but if we can't get blood down to your legs and your feet, they're going to continue to get open sores.
Если кровь не поступает хорошо вниз к ногам, к ступням к самим, то будут образовываться вот эти вот открытые раны.
And it doesn't necessarily mean a big surgery, but I think that we should have it evaluated at the very least.
You mean to
Should
see
you
the specialist?
wait until her wounds?
No. We
No?
should, I will give you the name of who we use.
Она даст имя этого доктора, к которому надо обращаться.
If you want to run that by her primary doctor, that's fine. But I think that the wounds need to heal, and if there's not blood getting down to her legs and her feet, the wounds will not heal.
Она говорит, если кровь не будет поступать хорошо к ступням, то эти раны не будут заживать. Надо пойти к специалисту.
С удовольствием.
Yeah, Galina would like to do that.
Yeah, I think that's wise.
Понятно дело.
Она именно об этих ранах, которые на ногах.
So do they have a nurse coming out to the house to treat these wounds, or what are you doing?
I'm
The nurse comes every week just to do the INR, but who treats the wounds.
Okay, yeah, that's not... What are you treating them with?
With antibiotics
Oral antibiotic?
and with oral too, and
ointment.
with neosporin.
Okay. There's much better things than that.
Есть
I
намного
asked
лучшие вещи,
in the
чем
hospital, do you have like something magical that will help to
heal.
not even heal, regenerating your skin or something? They
Right.
said, no, we don't have it.
Well, that's not, I mean, nobody has anything magical. That doesn't exist. But there are much better wound treatments that can be done. And so who is her primary hospital? Is it North Memorial?
Мгм.
Okay. I think as part of the workup with the vascular doctor, a wound clinic would also be a good referral.
Есть такая клиника по ранам, wound clinic. Это, наверное, скорее всего, в данном случае вашим лучше всего туда попасть.
Because just to put neosporin on it is not going to heal it.
Потому что только неоспорин, который вы накладываете, этого недостаточно.
Can I take these dressings off and look?
Better not,
Okay.
because it's like
It's what?
it's not easy to wrap it again because it's required a lot of things.
Okay.
It is like non-stick net and gauze, oil gauze, and plus some cleansing
Okay.
first. So
So you're not just putting neosporin in a bandage on it?
no. I open it up, then I'm clean with a cleanser, wound cleanser,
Mhm.
and then it's a little bit dry out, and then I put So I clean it. I clean the wound and I see that all edges are cleaned and the wound itself, how it looks. Then I put some oil in on stick gas with something.
The adaptic.
Adapted, yeah. This I put neosporin to save this wound and this wound, but this one is very open and I put some Solcacereal there.
Some what?
Some cream that is helping to regenerate your skin.
What kind of cream?
No, it is made in Eastern Europe right now. Some years ago it was done in Switzerland, now they are not producing it. My son brought something different. He was in Swiss and he asked for this Solcacereal and they said no, for a long time they don't do it anymore, but they give him something different.
Something over the counter?
They sell over the counter. They're not.
With no prescription? But you don't know what it's in it?
It's different than it was Solcacereal. Solcacereal, it was the extraction of calf blood, this full extraction of proteins from the blood. And this cream that he brought several days ago, he returned, it's called, I don't know, I didn't use it yet. It has argentum and something, maybe I have it if I can open it up, I don't know.
All right, well,
And I'm putting then I put the gauze depending on the wound. If it's licking wound, I put abdominal pad. If it's just a simple one, I put just a simple one.
Well, I'm concerned about these wounds here
Yeah.
because they look pretty deep.
Она больше она волнуется о каких-то ранках вот
Yeah,
здесь,
because
потому что они очень глубокие.
all then it's happened, her legs became and foot became full of water, very, very puffy. She just cannot use any shoes or anything.
Well, I think this is going down. I think that's bone in there,
Она говорит, что там до кости дошло.
down here.
Mm-hmm.
Yeah, you hear that?
So
Ой, болит, Галечка?
Yeah.
Пень.
Well, first thing we need to do is get an X-ray.
Сначала надо сделать рентген.
And then, but who is coordinating the wound care? Who is managing that besides you?
Dr. Labin, I believe.
Okay.
We will see him next week.
All right. Well, I think that it's important that we coordinate because I think this is definitely not going to heal unless we get some blood flow down to the foot.
Она говорит, что надо кровь, чтобы циркулировала к ноге, к ступне. Тогда это будет заживать.
And I have a question about this black spot.
That's nothing. No, I have nothing to worry about. Just a little bruise under the nail.
But
Об
it's
этом
for
волноваться
seeing for
нечего,
quite
это
some
просто
time already.
синяк под
Yeah,
ногтем.
it takes the nail a long time to
Вот
grow
она
out,
больше об этом
and it will come out
волнуется.
with the nail. So the things that we need to do are, we need to get you connected to a wound clinic.
Во-первых, надо в эту клинику по ранам.
Пусть он даст
We-
туда.
Окей.
We need to connect you with a vascular surgeon who can start looking to see.
И с хирургом, который занимается сосудами.
Right, because if we can't increase the blood flow down to your feet, then you're probably gonna, very possible you could lose the toes.
Она говорит, что надо, чтобы кровь циркулировала лучше к ступне.
Right,
Потому
so
что
this,
могут быть всякие неприятные последствия.
this all needs to be a coordinated effort,
И
so.
это все должно быть скоординировано, собрано вместе.
We're going to give you a different shoe to wear on this foot because those shoes are rubbing on the toes.
Она вам даст from here.
We're gonna give her a post-operative shoe.
Она, now,
Yeah.
Она вам сейчас выдаст какие-то ботинок какой-то или туфель, или я не знаю что это, который специально для вот этой больной ноги. Just for one foot?
Yes, just for the
Только
one,
на эту ногу.
for now. And I'm not saying, Anna, that you're doing a bad job, because I'm sure these are much better. But if we don't get the blood flow down to them, we can do whatever kind of dressings you want to do, and these aren't going to heal. So I think this is, and I will send a letter to Dr. Livio and make sure that everybody knows what everybody else is
Она
doing.
отправит письмо к вашему доктору, к Лабину,
Okay.
чтобы
Вот тут
он знал,
right now
что
here.
происходит.
I will put a bandage on that with some
Она это
antibiotic.
заклеит место.
So, yeah, so we'll get that all started here today.
Да, она говорит, что надо начать с этого сегодня.
And, so her primary hospital is North Memorial?
Мгм.
Okay, so, yeah, these vascular surgeons are over at North Memorial.
Вот эти вот хирурги по сосудам, они
Да,
как раз
да.
находятся в North Memorial.
What was she in the hospital for?
Oh. I don't know. I already cannot even explain it. I forgot. No, I don't forgot. But it was like, it was a month ago, just before Memorial Day,
Mm-hmm.
and it was a regular visit to a doctor, and they run a blood test. And next day they called and said me, oh, you know what? Creatinine is 3.5, so we need to stop any diuretics.
Mm-hmm.
And we stopped, and they said, okay, because it's Memorial Day, some nurse come on Tuesday and run another test, and that's fine. So I stopped. It was like Thursday, Friday, Saturday, Sunday, Monday. She became like puffing because everything is stopped.
Mm-hmm.
Her legs became like this. She gained 10 pounds, and and the nurse came on Tuesday morning and ran the blood, and no one called me. I called them Wednesday, Tuesday, Wednesday, Thursday, asking for what to do, for some instruction, what is the blood test and what should I supposed to do. And they told me, okay, creatinine is back to 2.1, so you can start diuretics.